a 67-year-old man presented to the casualty with chest pain, and he is a smoker and he take a atorvastatin tablet for cholesterol. See, one thing importantly, what point out here most important is that the patient is a smoker. Okay, the patient is a smoker, and he takes a tablet for cholesterol. Next, we should understand what the ECG talks about. Here, the ECG, we should interpret it systematically. Okay, so first the ECG, you should look at the rate of the ECG. Okay, the rate of the ECG can be easily be interpreted by the number of small squares, in one RR interval. Okay, calculating the number of small squares in the RR interval. So dividing 1500 by one number of small squares in RR interval, or a number of large square, 300 divided by number of large square. But this will happen, or this will work only if the regular rhythm is regular. Okay, so if the rhythm is irregular, you take that you take as 10 seconds. You take 10 seconds. Okay, 1 second means how many big squares? 1 second means 0.2 seconds is one big square. Okay, one big square is 0.2 seconds. So into 5. So 0.2 into 5, that is seconds. So into 10, 50 big squares forms 10 seconds. Okay, so if the irregular rhythm, that is a P wave not proceeding every QRS complex, or no QRS complex after P wave, in such cases we take it as irregular rhythm, and we count 10 seconds number of QRS complex in 10 seconds, number of QRS complex in 10 seconds, then multiply it by 6, number of QRS complexes in 10 seconds and multiply it by 6. Okay, this is the formula. So what does it here occur? Here, of course, we clearly see the regular rhythm strip. Rhythm strip means rhythm strip means lead 2. Okay, lead 2 is the rhythm strip. So you see the rhythm strip, whether any regularity can be seen or not. You see that the rhythm strip here, this P wave QRS. Here is no P wave, no second is no QRS. Here it is P wave, no QRS. Like that it changes. So what you do, that this is not an irregular rhythm, this is an irregular rhythm. So first you calculate 50 big squares. From 50 big squares, you can calculate the rate of the ECG. The 50 big squares means calculate from here. Okay, one. Okay. So there are there we can see that there are 12 complexes or beats in this 50 big square or 10 seconds. So you calculate that if the irregular beats, you calculate the rate is like there are 12 beats into 6, that is number of QRS complex in 10 seconds into 6, that comes around 72. So the beats, the rate of this ECG is 72 beats per minute. Okay, that is the rate. Next come the rhythm. So here we know that the rhythm here, it is not at all regular. We already discussed it. The rhythm is not at all regular. Here we can see P wave. Here we cannot see P wave. Here we can see P wave. Here we cannot see P wave. So this is not at all regular. These are identical waves. These two are identical waves. These two are identical waves, and there is no P wave in between. No P wave. So what could see these are this is a correct wave with P and QRS complex, and this is also PR QRS complex. This is also P and QRS complex. But here comes the two identical waves which are do not having P waves. Here also this is a PRS complex, is the P and QRS complex. So this is a case. This could be two identical waves without P wave. So what could be termed? They can be supraventricular ectopic beats. There can be supraventricular ectopic beats. You see in the rhythm, you see that this is a P wave is following the QRS, but here there is no P wave not following QRS, but here it is following QRS. Here it is not following QRS. This is P wave following QRS. You see these beats which are following QRS. These are sinus beats. These are sinus beats. But in between, you see some beats which are probably with their ectopic beats. They are supraventricular beats, or probably they're ectopic. Why? Because there is no P wave. In between the sinus beats, you see some supraventricular ectopic beats. Probably they're ectopics. Okay, so that's a reason here.
of these beats, P waves are buried in the previous QRS or T.
See, lead 1 is also positive, lead AVF is also positive. So if AVS was negative, then you could have checked the lead 2. If lead 2 is positive, then it is a normal axis. If lead 2 is negative, then it could be a left axis. Okay, so simply also take the lead 1 and lead 2 also, both are positive. So we could continue, or we can say that it has a case of a normal axis only. Okay. Normal axis only. Why we are telling it is normal axis? Because the lead 1 is positive and lead AVF is positive. Okay, if lead AVF was negative, then we have check the lead 2 for positiveness or negativeness. If it was negative, it is left axis deviation. If it is positive, it is normal axis. Normal axis is minus 30 to plus 9, plus 90. This is a normal axis. Here the axis is normal in this case. Okay. Next comes the PR interval. When you take look to this leads to rhythm strip, you say that the PR interval starts from here and ends here. It is 7 small square. Okay, PR interval 7 small squares. PR interval 7 small squares. 7 small square PR interval means what? When it is a 7 small square PR interval, it means 7 into 0.04. That could be 28. 0.28 seconds. So 0.28 seconds means it is 280 milliseconds. Okay, 280 milliseconds. What we should understand here is that in normal PRS complex, normally the PRS complex is the rate from 120 to 200 milliseconds. Okay, 120 to 200 milliseconds. But here it is 280. So the PR interval is prolonged. Okay. PR interval is prolonged, you see that whether it is prolonged in every leads or in every beats, whether the PR interval is prolonged or not. Here say it's 7 small square. Here is also 7 small square. Here is also 7 small square. Here is also 7 small square. So what could see say that the progression is not the prolonging in every beat. It's not prolonging. The uh, the even though it's prolonged, it is fixed. It is not changing in every beat. Like when you talk about the Mobit's type 1 bundle branch block like that, it's not prolonging in every beats and skipping a beat. Okay, so we can conclude that it is a case of a prolonged PR interval, but it is regular. This is can be sinus beats only. Since the P waves are followed by QRS, these are sinus beats only. Okay, sinus beats. Next comes the QRS complex. You see the QRS complex, how many small squares are the QRS complex? It's just 3 small squares. Okay, in the QRS complex, there is only 3 small squares. 3 small squares in this QRS complex. So it will be 3 into 0.04 seconds. So it is 120, around 120 milliseconds comes. So it should be more. Actually, when you check clearly, we can see that this is the QRS complex is 1 to not 3, not 3, not 3. It's not 3. It's just less than. I can say it's 2 to 3. Or we could say it's less than 3 only. So it could be less than 120 milliseconds. The final result is less than 120 milliseconds, which is normal QRS complex. Okay, this is normal QRS complex. That's it. You check the Q wave. When you're looking for the Q wave, you should check all the leads. Is there any Q wave here and there, that and these? So you see a small Q wave here. You see a small Q wave here. So all in some leads also you see some small wave here also. And here also you could see that small Q waves, but you understand that these Q waves are not at all pathological, like it's not more than 2 or 3 small squares, so it's insignificant in taking that Q wave, so just leave it. Then the Q waves, no pathological Q, we can directly tell that there is no pathological Q waves. Okay, next comes the ST segment. ST segment is very important. ST segment. ST segment. You see in every lead, which all leads you see ST segments. Yes, I have seen that this ST segment is elevated here. ST segment elevation. Here also ST segment elevation. Okay, ST segment elevation, ST segment elevation. You see in AVF also a fecal elevation, and you see ST segment depression in one. You see AVL lead, and you see V1, V2, V3, V4, V5, V6, all the ST segment depression. Okay, you can clearly, visibly, you can see in this ECG that ST segment elevation in 2-3 AVF, and almost other leads you could see the ST segment depression. So you can write sir ST segment elevation in 2-3 AVF, 2-3 AVF, and ST segment depression in 1 AV, AVL, V1 to V6. Okay. Next comes the T wave. When you looking for the T wave, what you see here is next comes the T wave. We told that the T waves, about the T waves, the biphasic T wave in lead 1, and from lead V1 to V6 there is T wave inversion. That's it. Next is the interpretation of ECG. So final, coming to the interpretation of ECG, we have a sinus beats with intervening supraventricular ectopic beats. We have ST elevations in 2-3 AVF and depressions in almost other leads. So final interpretation, what we can say is that what we conclude here is ECG, it will be a sinus rhythm with supraventricular beats ectopics, that is ectopics. The ECG is at 72 beats per minute with normal axis. Okay. So this is the final diagnosis or interpretation that we reached. So we also see some ST elevation in inferior leads. Okay, inferior leads, ST elevation. So this is the inferior lead ST elevation, 2-3 AVF. Okay, inferior ST elevations. Since it is an ST elevation MI in the inferior leads, which means this is an inferior MI. This is an inferior MI with, it could be an inferior MI, inferior lead, that is inferior ST elevation MI with rhythm abnormality. Inferior ST elevation MI with rhythm abnormality. You see that the ST elevation MI with rhythm abnormality. The rhythm abnormality will be probably due to the ischemia of the sinus nodes, that is SA node ischemia. You see the inferior infarct is occurring in this ECG, and the depressions in V1, V2, V3, V4, V5, these are the reciprocal changes, which means the inferior myocardial infarction has progressed posteriorly, and that posterior MI is causing the reciprocal changes in the anterior leads. Okay. So if you have taken the V7, V8 lead, we could clearly say ST elevation in that leads. Okay. And you see that the inferior reads or inferior part of the heart is supplied with the right coronary artery. So probably here the right coronary artery would be involved. Okay, right coronary artery will supply the inferior wall of the heart. So you need for the treatment, you need percutaneous coronary intervention. That is very important to save this patient. Okay, that's very important. And thank you. Have a nice day.